Stuart McMillan.
Thank you, President. Also to ask the Scottish Government what discussions it has had with the British Medical Association regarding the impact in Scotland of its guidance advising GPs to consider reducing their pensionable pay or retiring early due to changes in inflation, and the way that these are used in calculations around GP pensions that reportedly leaves them liable for significant tax changes.
Cabinet Secretary.
So the member and other members will be aware that the majority of the pension issues raised are reserved for the UK Government, and I'm of course, haven't had the opportunity to meet with the new UK Government and health counterpart, but have raised these issues before, and there hasn't been any flexibility on their position in this particular matter. Scottish Government and I have regular engagement, of course, with the British Medical Association, and the issue of pensions arrangements that affect GPs and NHS employees directly and via the NHS pension scheme have been raised with me. I have an introductory meeting with the new chair of the BMA later this month, where I'm certain the issues raised by the member will once again be on the agenda.
Stuart McMillan.
Thank you. I thank the Cabinet Secretary for that reply. In addition to other MSPs from across the Chamber, I recently met with the leadership of the local medical committee who represent GPs and their practices within the NHS Council Glasgow and Clyde area. And during that meeting, they highlighted the long-standing issue of pensions and how that they are leading some GPs considering leaving the profession early or reducing their working hours to avoid what the BMA has claimed that amounts to, and I quote, a pension theft. As our NHS continues to contend with the impact of the pandemic, does the Cabinet Secretary agree with me that it's vital that the UK Government considers changes to the tax-free annual allowance charges so that more GPs are not faced with this dilemma, which will only exacerbate the staffing issues facing general practice?
Cabinet Secretary.
Well, I agree wholeheartedly, and as I've said before, I've raised this issue with UK counterparts. There has been no flexibility in the position. There are actions that we may well be able to take, but it's taking money from other areas within the health budget to try to mitigate a problem that the UK Government are showing inflexibility on. So I will call on the UK Government. I will look forward to the first meeting with the new Secretary of State for Health, I'm sure in very short order, and I will raise these issues with her again, and I'm sure the DFM, John Swinney, in his position, will continue to convey to the Chief Secretary of the Treasury our displeasure at these pension changes that have caused such difficulty for GPs and doctors right across the country.